LANAP for me, I didn't know about LANAP really initially. I just wanted to do something different because I've done periodontal surgery and cutting gums, for 30 years now, 35 years. And I knew that the patient would go home and they will have like pain, and sometimes they stop doing the treatment because it's so painful. I needed gum treatment and surgery because I had some infection that happens from moving teeth around with braces, and bacteria got underneath the gums, and I didn't want anybody to cut my gums, believe me. So that was my whole idea. So I went to the convention and I was looking around and I researched everything, because I'd done the surgery and I didn't want anybody to do it for me, honestly. So when I went there and I looked at it, I said, you know what, this is maybe the best thing I can have, because they're not going to cut my gums. I can get rid of the infection, and the bone can grow back around my gums and my teeth. So that was the whole idea. And it's not cheap, believe me. I know it's expensive, but my receptionist said, she kept pushing me, no, we don't want to get it. I said, you know what, I'll get into it. If I don't like it, I don't have to do it. So that's how I got into it. And I love it. I love it. The patient love it. We have a lot of success with it. And I can save teeth now that nobody else can save. And I tell you the truth, I have several cases, many cases actually, because I've been doing that now since for almost 7 years. Some people, because they don't understand how it works, they think it doesn't work. But when you've done it and you have it done on yourself, and I tell my patients, if I wanted something done for you, it's because I know it's going to work for me. But if it works, it doesn't matter how much it is, I'll buy it, because I know it's going to help my patients. That's the whole idea, If I want to do something, I want to make sure it's going to work very good for my patients. You get patients sometimes and they come and they went everywhere else and they told them, oh, you're going to have to take out your tooth and put an implant, or take out your tooth or get a denture or partial. But I can look at many of those cases and say, you know what? I can try the LANAP and I know it's going to work. Now I can do it actually for implants. Patient comes in, they have implants that are failing or infection around implants. I can clean up with the laser, and I don't have to take the implant out. I like the way the LANAP works. It's a laser procedure. If you had your eyes done with a laser, it's the same thing. You don't need to cut anymore the cornea or whatever. Same thing with the laser. You go in, you clean up the gums, you remove all this junk or gunk that you have underneath the gums, and you clean it up, and slowly the bone will go back and the gum will heal very quickly, really. So I've had very, very good success with the LANAP, and I'm very, very pleased with it. And I will offer it to all my patients as a first option.